My name is Laura, and I'm a psychiatric nurse. My situation where I work is a little different than some psychiatric nursing jobs. I work on a secured locked unit, and the majority of my patients actually come to me from the court situation. They're petitioned through the courts. Somebody that they know has actually filed a petition for them to come into care because they're a danger to themselves or somebody else. So typically they have a serious mental illness of long-standing history. They have stopped taking their medication for some reason, and they have decompensated to the point where they often come in not really wanting to speak, not having bathed for sometimes weeks or months, and actively psychotic, hallucinating, having delusions. And so my job is to interact with these patients and try to convince them to be compliant with their treatment and take their medication. Because it's a court unit, the court pretty much dictates to some degree the pace of the patients coming and going from our unit. And discharge planning happens right from the very beginning when patients come in. So when we have patients on admission, we're already thinking about, pacing them through the discharge process. And most of our patients go back to some sort of assisted living situation, whether it be back to a family member's home or a group home. Some of our patients can't be stabilized in a short time frame of 2, 3, or 4 weeks. They actually need to go to a state hospital, and we prepare them for each of those phases. So that's part of my job too. So my typical day usually begins with getting a report from the outgoing shift, and in that report I give information about patients who have been admitted since the last time I worked. I also get information about changes in the patient's condition, if they've been started on medication that's new to them, if they've had any medication side effects, if they've had any agitated behavior or irritable behavior. Safety is just a real big part of our, what we deal with every day. Also, a lot of our patients, or some of our patients, I would say, come through a jail diversion program. They have actually been sent to jail because of their erratic behaviors, but because they have a psychiatric diagnosis, they're not really appropriate to be in the jail setting and just need to be in active treatment. So we deal with people like that as well. After report, I like to make rounds on the entire unit. I can have as many as 12 patients to care for during a day, but I actually like to look at everybody on my unit, and we do what we call taking the temperature of the unit. We like to just see everybody and make sure that they're comfortable. Anybody who seems to be irritable or responding to internal stimuli such as delusions or having hallucinations, we like to target them and give them a little extra care. Sometimes, therapeutic communication with somebody who's going through, some uncomfortable stage can often de-escalate them. And, for others, they need some additional medication. And we always like to try to, act preemptively in those situations just to prevent any sort of violence on the unit with those patients. So just seeing everybody is really important, and then making rounds similar to that all throughout the day is important just to maintain safety on the unit. After I do that, I return to the nurse's station, and especially if I've been off for a couple of days, I like to just go through my patient's entire clinical profile and review all of their doctor's orders, just so I know everything that should be happening with them that day, if they've got any lab work due, if they have any abnormal lab work, just to understand their medications. A lot of our patients do have medical problems when they come in, and in addition to stopping their psychotropic medication, they may have stopped taking their insulin and their heart medication as well. So it's not uncommon that we have people who have blood sugars out of control or dangerously high blood pressure. So it's really important to keep track of those things too, not just the psychiatric side of things. So like in most inpatient facilities that are locked, we do have a med pass window where we actually pass medication through a glass window to our patients. And I typically don't pass meds that way. I usually walk my medication out onto the floor so I can talk to my patients face to face. that's just another really important time for me to have some one-to-one with my patient. Number one, just to make sure that they're swallowing the medication that I'm giving them. I can assess them more thoroughly for any medication side effects. Some of our psychotropic medications can have, some pretty devastating side effects that are important to catch in early stages. I ask how they're sleeping because sleep hygiene is real important with our psychiatric population. I can assess their orientation. I check to see if they're still responding to hallucinations or delusions. And the longer that you talk to somebody, the more apt they are to reveal those things to you. Also during the day, we interact with other members of our team. We have social workers and physicians who are there all the time. So that pretty much encompasses my daily routine and just touching base with those patients on an hourly or more basis, de-escalating them when necessary, and just doing a lot of patient teaching and encouraging compliance. The qualifications to become a psychiatric nurse are the same qualifications to become a nurse anywhere, really. You have to go to school. You can get a 2-year associate degree in nursing and sit for the nationalized board exams, which is the NCLEX, and become a registered nurse that way. Other people like to go to 4-year college or university and get a bachelor's degree in nursing. They sit for the exact same NCLEX exam to become an RN. I think the versatility of having a bachelor's degree is a wonderful thing, and if you decide at some point later that you might like to further your education and get a master's degree or doctorate degree, it's important to have a bachelor's degree. There are some employers that really require it to be a psychiatric nurse in their facility that you pass some sort of psychiatric nurse certification program. The American Nurses Association actually facilitates some of that, and if you're interested in that, you can go look at their website and learn a little more about that. I would say the qualifications to become a psychiatric nurse personally, from just the people that I work with, is you really must like people. You have to be extremely patient because our patients are sometimes very difficult to work with. You have to be able to, put your own preconceived notions and stereotypes of mental illness away and to deal with some of our patient population. And you have to be a really good listener, because most of what I do every day is just be reassuring and listening and encouraging to my patient population. I don't necessarily give a lot of advice. I do a lot of teaching, but just to be able to, step back and just be an observer of human nature is an important quality. I would say the best part of my job is being able to see the person who walked in 2 weeks before who was isolative, who hadn't bathed for maybe 3 months and was delusional, be able to have a normal conversation with me and be interested in their personal hygiene and actually be willing to take their medication voluntarily. That to me is a success story, and being able to see them go out into the community, whether it's back home or into a group home under supervision. And so that's very rewarding. One of the worst parts of my job is maybe to see that same patient show up again 3 or 4 months later or a couple of years later, having stopped their medication again and in decline, and having to go through the same process with them. We have several patients that I've seen over the last few years come in over and over again, and that can be, very frustrating. Another bad part of the job is, because so many of our patients are volatile, violence on the unit is a real big issue. I've actually been physically assaulted by a patient unprovokedly. They were responding to internal stimuli. They really weren't on my radar. They weren't my patient that day, but they did strike me. And, that's very anxiety producing as a nurse, to think that you have to go back out on that floor and take care of your other patients and worry about your safety. So that's one of the reasons why I just stress making rounds and knowing who your patients are and what they look like and what they're doing from 1 hour to the next. Another good part about my work is I get 7 days off every 14 days, and that's wonderful. The bad part is I have to work 7 days out of 14 days, so I work 12-hour shifts, and they can be really rough and long. It's not uncommon for us to get 12 or 14 admissions in one day, and maybe also to discharge that many people in one day, so our turnover is brisk, and introducing that many patients into our facility, into our milieu, into our environment can be very stressful for the other patients who are already there and for the people coming in who are stressed about being there. So it makes for a long day. Sometimes I've worked 14 or 16 hours just finishing up work on those extremely heavy days of admissions and dismissals. And it's not as easy to do over 50 as it was when I was 25. So I would say, you know, the 12-hour shifts are definitely difficult, but it's rewarding to have those extra days off with my family, so I appreciate that. My advice to anybody who has enjoyed their psychiatric nursing clinical, or even somebody who hasn't even started nursing school but might be interested in psychiatric nursing, is to, you know, go ahead and put your all into your clinicals if you're still in school or thinking about going to nursing school. But, you know, my personal advice is to, if you are getting ready to graduate and deciding where you might want to apply for a job, is to definitely get a lot of medical nursing experience on a traditional medical unit to be able just to hone your skills in assessment of your patient. Assessing somebody who's psychiatrically ill for medical problems is a lot more challenging than, you know, assessing someone who's cooperative. So I think that's important to have those skills on board. If you are interested in psychiatric nursing, talk to people who are psychiatric nurses. Spend a little more time with your clinical instructor in your psychiatric rotation, and just, you know, read some books. There are some great books out there about people's experience as physicians or nurse practitioners or nurses in the field of psychiatry that are, you know, pretty eye-opening. And I would just say, give it a try. If you're a student nurse and you want to get a job in the summer as a behavioral tech on a psychiatric floor, do so. It will give you a lot of exposure, and you kind of know what you're getting into. As nurses, we, you know, treat the body, mind, and spirit no matter which area we work in. The emphasis in psychiatry is more on the mind and the spirit. And so if that's something that seems of interest to you, I would encourage you to pursue that.